Hi, my name is Dr. Alex Dimitriou, and I'm the owner of Menlo Park Psychiatry and Sleep Medicine. The following brief presentation is not intended to replace the opinion of a licensed medical professional or a physician, and we always encourage you to seek the professional opinion of a doctor before making any changes or diagnoses. The topic for today is anxiety. A lot of times people ask me, Alex, how do I know how much anxiety is normal? How do I know if I have an anxiety problem? And I think one very good way to conceptualize it is to understand that anxiety is really, it's a spectrum. On one end, there's people that care too little. These are the people that can break the law, cheat on their taxes, do god-awful things, and take a nap in the afternoon and pretend like everything is just fine. Um, Moving higher up, most of us fall into that category of normal anxiety where you're able to respond to situations, you're able to muster up the reactivity as needed when needed, but you're also able to turn it off when it's not necessary. Going further down the spectrum is where we start entering the realm of too much anxiety. And this is really where people often come see me. A lot of times, people I see will say, they're having, they'll often have trouble with rumination, which is a tendency to kind of get stuck on the same thing and ponder and mull it through like too much. There's people that will often tell me that they tend to like obsess and ruminate about things at work or problems they're having. And a certain amount of that is normal, but at the point where it becomes a preoccupation, it certainly starts interfering with your ability to actually problem solve because of the very repetitive nature of it. A lot of times, patients with too much anxiety will come in and tell me that they have issues with sleep. And the way anxious people sleep, the easiest way to consider it, to conceptualize it, it's like battlefield sleep, where if you can imagine sleeping in a dangerous situation, you'd have a hard time falling asleep. Sleep would generally be light and easily interrupted. Sometimes these people wake up in the middle of the night and they can't fall back asleep. A lot of times they'll actually report waking up and feeling like their head is kind of going already, even though they know they need more sleep. And these people with these sleep issues will also tend to kind of wake up well before the alarm clock in the morning with trouble getting back to sleep. It's that feeling of you woke up at 6, even though you had to be at work at, you have to wake up at 8, knowing that you'll be tired during the rest of the day. Incidentally, a lot of my anxious people also tell me they can't nap during the afternoon, and that also is related to this inability to turn off the brain and just kind of relax. The other thing I should mention that's important is I see anxiety as sort of the opposite of mindfulness. These days, that's become quite a popular term, and we're all striving to be present and be there and be actively enjoying, what we're doing, especially in our off time. By definition, anxiety is sort of the opposite of mindfulness. When you're so preoccupied about either the past or the future, it's so difficult to be present. And in many ways, this is where anxiety is quite a robber because it steals these beautiful moments of either being with your family, with your children, being on vacation, and just being able to kick back and not think about all the issues that you normally do when you're at work or when you're not away in a beautiful place. So here at Menlo Park Psych and Sleep, we specialize in various forms of treatment for anxiety with a chief focus on minimalist pharmacology. We try to be as conservative as possible with the lowest possible medication burden that gets the highest overall efficacy. We focus on sleep. My background's in sleep medicine as well as psychiatry. And certainly we'll do brief behavioral and therapeutic interventions to give you the tools you need to reduce anxiety in the future and not necessarily need medication going down the road. I hope this has been helpful. Please feel free to contact us.